So we will start our presentation at 6:05, waiting for everybody else to come in. Welcome, guys. Thank you guys for all coming in today. First, before we get our presentation, I would like to introduce myself and my co-presenters. My name is Dhruv Patel. We have Prerna, Ketki, Isha, and Shreyas. So the topic for today is for TXCC, our topic for today is COVID-19 vaccine. So throughout this presentation, we have QR codes all over. So we would like you to use your phones to scan these QR codes so you can get more information on the topic at hand. And if you want further this information later on. So let's begin.
Hi, so first up on our agenda is our focus. So as an organization, what we do and what we focus on. And then we have actual information about the vaccines. And then we'll get into how exactly Texas is going about distributing this and their phases and everything like that. And then Shreyas and Isha will get into the risk assessment and a couple of other initiatives that we have going on for TXCC. And then we'll finally get to hear from our two guest speakers, and we'll conclude with a small question and answer session. So TXCC's focus is basically focused on 4 pillars. The first one being to educate. With all of the misinformation that's circulating, we wanted to create a hub of accurate information that's easy to access. And then we also are going to partner with local organizations and charities to come up with volunteer opportunities that follow the CDC guidelines, but also give us a chance to give back to our community. And then we also plan on fundraising to support causes which have been hit hard by the pandemic and have potential to spring back up with a little bit of help. And then lastly, we have personal initiatives such as the care kits and the risk assessment that we'll get into later in the presentation. So moving on to the actual vaccines, we're going to be talking about the 2 main ones that have been approved within the United States. The first one being Pfizer and the second one being Moderna. So first up, the Pfizer vaccine uses mRNA technology and has about a 95% efficacy rate. People must be 16 years or older to get this vaccine, and they have to come back in about 21 days for a booster shot to guarantee the maximum possible protection. Here's some other information about the vaccine. Sorry, Dhruv. And then we have the Moderna vaccine, which also uses mRNA technology and has about a 94.1 efficacy rate. And then in contrast, people have to be 18 years or older to receive this vaccine, and they have to come back in 28 days to get the booster. And both of these vaccines are being distributed within Texas, and people have been getting both of them successfully.
So what is the current Texas procedure on the vaccine? So projections have been made according to Texas Department of Health and Safety. So currently we're in phase 1A and 1B. So we will get into this further on. So this is our current vaccine timeline. We're in phase 1A and 1B. So these, as I've mentioned, we'll get into further detail much on, but phase 1C is going to be starting soon, and we'll explain that later on. But phase 2 and phase 3 under consideration that we have made projections based on other states and Texas Department of Health and Safety.
So as Dhruv mentioned, phases 1A and 1B are currently in action. Phase 1A includes all the workers that are at a very high risk of acquiring COVID-19 at their workplaces. So this phase is split into 2 different tiers. Tier 1 consists of the following. These are paid and unpaid hospital workers who work with COVID-positive or high-risk patients, as well as residents and staff of long-term care facilities. And this word staff is not restricted to those who just directly interact with the patients and the residents, but it extends to the custodial staff, kitchen workers, all of them. We also have emergency medical service providers under this tier. So these are the people who respond to 911 calls, paramedics, these all qualify. And ultimately, we also have home healthcare workers and hospice workers under Tier 1. Tier 2 of Phase 1A consists of other healthcare workers. So these are outpatient staff who interact with symptomatic patients, including people who work in correction facilities, staff who work at laboratories and diagnostic facilities, as well as non-emergency transportation service staff and other support staff. We also have staff at private freestanding ERs and clinics in Phase 1A, Tier 2. Sorry about that. Staff at private and freestanding ER clinics, workers who work in pharmacies, as well as people who administer COVID-19 tests and vaccines, school nurses, and last responders who deal with dead bodies that may or may not have been infected with COVID-19. Moving on to Phase 1B, which is also active right now. This one consists of people who are at high risk of severe illness from COVID-19. So people qualify if they are above 65 years of age, or if they're above 16 years of age and they are at high risk of severe illness from COVID-19. The people who are 16 plus need to have a chronic medical condition such as cancer, COPD, kidney disease, Down syndrome, heart conditions, obesity, sickle cell disease, and diabetes, as well as pregnant females and organ transplant patients. Moving on, we have linked an interactive site which includes all the vaccine providers throughout Texas, and this is constantly being updated. This includes places where the vaccine may have run out, which kind of vaccine is available at which location. And even if you don't qualify under Phase 1A and 1B right now, I'd like everyone to scan this and save this link in their phones for whenever the other phases are rolled out, because it's a wonderful resource for everyone to get a vaccine. So let's take a moment and scan this link and just save it on our phones. And if anyone needs to, we can come back to this link at the end of the presentation or email it out. Just let us know what y'all need.
Okay, so what are the future phases? As I mentioned before, Phase 1C is a mere extension of Phase 1B. This group is focused on the ages of 65 to 74. Furthermore, and the age group between 16 to 64 who have 2 or more high-risk chronic diseases that are not listed under the Phase 1B diseases. This also includes additional groups that are labeled as other essential workers. These groups of people include who are in transportation, logistics, water and waste, food and service, and health and housing. So what is Phase 2 and Phase 3? So Phase 2 and Phase 3, based on the projections we have made, this is going to be your area where you're going to get the vaccine. So Phase 2 goes from February to March, and in this group, we're going to focus on people who have other diseases but that are not high risk as labeled under Phase 1B. Furthermore, this also includes the supply and demand growth. So as Texas has more influx of supply of the COVID-19 vaccines from the FDA, it will demand them out into the supply using clinics, pharmacies, and other private organizations that they can fund the vaccine. Phase 3 is your general public vaccination program. This is where you're most likely going to get the vaccine, and this phase begins around in April and goes all the way to June. So I'll wait one more moment for the first QR code. That's our first QR code focusing on the care kit. We're going to mention that, go into more detail of it in the further slides. The second QR code underneath it, that's our text. That's a current Texas plan on how to deal with the COVID-19 vaccines. So this is going to take you straight to the Department of Health and Safety website, where you can learn more information on each specific step on how we're going to tackle it. Moving on.
So now let's talk about TXCC and our initiatives. So through extensive research and calculations, our team intends to create a 3-part risk assessment. So the goal of this risk assessment is to help people truly understand their situation during the pandemic and help people and their families make better decisions overall. The first part of this risk assessment is the personal severity test. So this takes into consideration someone's health, medical conditions, and age. What we have, you can actually scan the QR code to access this. So please go ahead and do that. It's still in development, and obviously as new data and stuff comes out, which is kind of how we derive this formula, this will be updated, and we hope that this will be a resource that people can use. Additionally, we also want to create a close contact test score, which tells you the risk in regards to the people that you see on a weekly or people that you see on a daily basis. We also think this is important because when you do go out and if you do get COVID, it affects not only yourself, but the people around you. So we want to make sure everyone is aware of that. And finally, a potential infection test. So using data on where you've been and the kind of precautions that you've taken, et cetera, we plan to create a score that, a score that tells you how likely at risk you might have had to contract the virus. So moving on. Additionally, we have also created a website, which is Texas spelled out, covidconnect.org. You can also use the QR code underneath the website circle to access it as well. So the main goal with this entire website is to streamline a lot of the news and information with COVID, because we know that it can be very, very, difficult to manage it as the news is changing on a constant basis. And also create a platform to foster change. So just like how we're doing now, create new projects and stuff of that nature to really make an impact in our communities. Moving on, we also have a Texas COVID Connect podcast. And in this podcast, we discuss a lot of the hot button issues. So for example, I think a couple of weeks ago, we talked about racial equity, and then we talked about censorship and just anything in general. So we also have an episode on my family's personal experience with COVID. And we plan to continue this project a little bit more, and hopefully it becomes something that a lot of people will watch, and we'll see where it goes from there. And then also we have created something called the COVID-19 checklist. And so this was created in order to help families create infrastructure in case they do contract COVID-19. This was kind of created with the idea that every time you do step outside of the house, you're taking a risk at contracting COVID-19. And so with that in mind, it just makes sense to have a plan and make sure that you know what's going on. And from experience, a lot of the battle with having COVID-19 is a mental one, with not knowing what to do exactly. And since a lot of the information that we have online is in regards to prevention and how to curb the pandemic, not a lot of information is provided on what to do if you actually do contract the disease. So if you're interested in that, please do scan the QR code and it will take you to that.
Great. So along with our other projects, we're also working on our Care Kit initiative. So as we had initially sought out to do, we are taking steps to make tangible change by distributing care kits. So these care kits include masks, gloves, hand sanitizers, thermometers, and information cards sufficient for a family of 4. These cards include information from our COVID-19 checklist that Shreyas just mentioned on how to be prepared before, during, and after someone may have contracted the virus. Furthermore, the card will also have QR codes and links to other informative websites for these individuals. So with these care kits, we are planning on distributing them to homes in low socioeconomic areas, as many smaller cities such as Trenton are in dire need of personal safety supplies. So these cities have been brought to our attention through discussion with the North Texas Relief Organization. And this organization has been delivering meals to homes in more impoverished communities since March, and their organization has grown to over 9,000 volunteers now. So they're making massive change in local areas. We will be partnering with them for this project, and they are donating to us 2,000 masks and 400 gloves that we are very grateful for. And in addition to the North Texas Relief Organization, we are also partnered with UTD's Molding Doctors Club, and they are currently working on a fundraiser that will help us raise money to make these care kits. Therefore, we would truly appreciate any donation for this cause, and the link to our GoFundMe is available through the QR code on the slide, and we will also send it in the chat at the end of this presentation. And our first guest speaker is Dr. Smita Mahapatra, who is a pediatrician at Forest Lane Pediatrics, and she will be talking to us about her experiences as a medical professional during the COVID-19 pandemic and receiving the COVID-19 vaccination. So yeah.
Perfect. Thank you, Isha, for that kind introduction. Isha had asked me to very briefly speak about my experiences as a pediatrician during this COVID pandemic. Before I begin on that topic, it has to be acknowledged how difficult this past year has proven really for everyone. It is impossible to imagine trying to navigate being a first-time parent without any physical support, explaining to your children why they cannot see their grandparents or friends for months on end, or watching a loved one pass from a glass window after spending days in an ICU. These are just a few examples of the scenarios that people have endured these last several months and that healthcare workers have personally witnessed on a daily basis. Now, healthcare in general has always been a field requiring a degree of resiliency and adaptability, but the pandemic proved to be uniquely challenging and something that even the most senior healthcare workers had yet to experience. Thankfully, our group physicians met very early on last spring to brainstorm ways to not only take care of our patients, but to also protect our practice and staff in the process. We started utilizing telemedicine as much as reasonably possible and actually started examining sick children outside as curbside visits to help minimize exposure in our clinic. I can honestly say I never expected to be taking care of patients outside in the Texas heat and in full protective gear, but I'm so grateful that we had the means to do so with the goal of trying to keep everyone as safe and healthy as possible. Although we have seen a very large increase in the number of kids with COVID infections in the last few months, as always, our kids are typically incredibly resilient and most have recovered from the acute illness with very minimal symptoms. One of the unfortunate side effects we've also noted from this pandemic is the toll all of this has taken on our children's mental health. Everything from behavior changes in our school-aged younger kids to anxiety and depression in our older teenagers. I think I can speak for all of my pediatric colleagues when I say that we've been trying our best to support our families and patients through these stressful times and plan to continue to do so in any manner we can for the duration of this pandemic. Now, here we are almost 1 year into the pandemic, and most healthcare workers are finally feeling some sense of optimism with the introduction of the COVID vaccine into the community. Our practice has been very fortunate in that everyone medically eligible to receive a vaccine has gotten their first dose of either the Pfizer or Moderna vaccine. I personally have received both doses of the Moderna vaccine and did have some expected arm soreness after the first dose and headache, fatigue, body aches after the second dose. Receiving both doses of the vaccine will not change any of our practices regarding wearing masks and social distancing, as there's still the possibility of being asymptomatic and transmitting the virus to others unknowingly even after being vaccinated. Additionally, a certain percentage that receive these vaccines may not actually experience the expected protective effect. So until the CDC and epidemiologists recommend otherwise, we will continue to practice as safely as possible in both our professional and personal lives. We'll be concluding this presentation with a question and answer session, as mentioned at the end, in which I would be happy to elaborate further on any pediatric specific topics or concerns. Thank you.
All right, thank you, Dr. Mahapatra.
Thank you.
So next, our second guest speaker is Dr. Nilesh Chaudhari. He's from Houston, based on orthopedics. He has his own hand and foot orthopedics clinic. He has over 20 years of experience in orthopedics, and he has also too received both COVID vaccines. So he would like to share his experience, any questions you have at the end of the segment.
Thank you all for having me here, and thanks Drew for one of this nice initiatives. So, as we just learned from Dr. Mahapatra, the COVID has changed a lot of things for a lot of people in the world. Definitely, it changed a lot for us too as healthcare providers. Being a surgeon, we see the patients every day on an inpatient. So, as I explained, when it started in March, when COVID started as a pandemic, the biggest challenge we're facing in a routine our operating room is we using those masks and hats and gloves and those things as a routine for our surgical patients. When this pandemic started, our supplies was actually in a big issues for us over in all operating room in all hospitals. Initially in the March, April, when we shut down everything, the government shut down all the elective procedures for about 4 weeks. And because of that, the state and I think our country was not ready for this kind of pandemic, and we did not have enough supplies, especially gloves, mask and N95 mask. I think you guys probably all now know that words very well. Before, even though in our world we used the N95 mask, we used to call TB mask or high infection rate mask, so which we rarely used it even for surgical procedures, and that became a very important part of our routine stuff. I have been involved with a lot of procedures where patients had COVID positive, and how all healthcare providers, especially surgeons, anesthesiologists, how they deal with this. There's a big fear. We don't know how this is going to be, but I really appreciate and all courageous of healthcare workers, especially nursing staff in the hospitals, operating rooms, and how well they teamed up together, and we try to beat these odds of this massive pandemic. Fortunately, we are kind of went down, and we see the a better phase, and we start doing elective surgery again until November, December. Now the pandemic has picked up again, and our hospital is full of all patients in hospital. At one point of time, I go to the Memorial Hermann Southeast Hospital. We have 160 patients, which is in hospital, which COVID positive. If you see the capacity of the hospital is about 300 beds, so that's a more than 50% bed was occupied by COVID patients, and that including all ICU beds are taken away. All PACU, which is we call recovery room after surgery, has been shifted and packed by all ICU patients. So it's been a very rough rodeo for everyone. I think all citizens, but especially the people who are healthcare workers in hospitals. So I really give my all respects to the hospitalists who are actually working and seeing these patients, all nursing staff who put their they all a frontline worker, and how they kind of beat this out of the patients. So when the vaccines came in December, there was a lot of media conspiracy that we don't know how the vaccine is, and the politics and all this involved. And there was a big fear, is that the vaccine is safe or not? So when the vaccine started, we are the one, for us as a physician, if we don't really take initiative to take the vaccine, nobody else will take it. So as a physician, I don't remember any of my physician colleagues who I know personally have not taken vaccine. We all kind of, I was on a day 2 when the vaccine started on, I think there was a December 13 or December 11 when the vaccine started. I took in the day 2 my first Pfizer vaccine. We don't know what to expect. We know there's a science behind it. And as a healthcare workers, we trust science and we rely science, regardless of what media and all conspiracy theory goes behind it. And yes, I get some of the some like normal muscle pain at the vaccine site, but fortunately I didn't get much reactions with my first dose as well as second dose. But a few of my colleagues, I know there is somebody gets some fever for a day or 2, but most of people have done very well. The overall reactions and the risk of getting vaccines and issues, I think overall mortalities, it's a very, very, very rare compared to the disease itself. So, and even though right now, I am not really seeing directly COVID patients being in the surgical side, but I see a lot of patients have get it. Unfortunately, my 2 of the staff just recently came back after they got a COVID, and we have to keep them off from work for about 14 days. And it's not easy. What symptoms they go through it's we still learning a lot of things about this disease. The symptoms they present is a very different in a lot of people, and it's not a good disease to have. Even a lot of people recover. Some people end up getting damage to their lungs, which can be permanent or could be even long recovery required. So I request and really convince my all patients to get these vaccines going on. I also help them find the resources, how they can get it, because there's not enough information out there for a lot of citizens to really receive the vaccines. I would say one thing: if you want to beat this a big monster, the only way we can get it done is by taking vaccine as much as possible. And I'll be happy to take any questions you guys have it and answer to my best knowledge. Thank you.
Great. Thank you, Dr. Chaudhary. So this formally concludes our presentation. Now we will begin our question and answer segment. You're free to unmute yourself and ask any of our two doctors your questions and concern. You're also feel to type in your questions in the chat, and they will take a look and answer those questions when they get to it. Thank you. So a big round of hand applause, Dr. Smita Mahapatra and Dr. Nilesh Chaudhari.
Thank you, guys.
Thank you.
All right.
I have a question. This may be specific to Dr. Mahapatra in her dealings with children. Both of the vaccines have an age limit. And so, first of all, why does that age limit exist? And when do you think that age limit will be removed? When will kids be able to get the vaccine, do you think?
So they actually had not, tested the vaccine in kids under 16. They're actually starting those vaccine trials right now. There's several throughout the US that are starting, and usually most of them are starting in kids that are 12 and above. So hopefully by the end of this year, we'll have enough data that this information can go through the FDA and potentially the vaccine can be approved for younger kids. And typically the way it works when testing these vaccines in our pediatric population, they'll start with the kids that are maybe 10 to 12 and up, make sure that they're able to tolerate the vaccine fairly well without any complications. And then they'll slowly start migrating to testing to the younger kids. So as of right now, actually our practice is in the process of trying to become approved to be a part of one of these vaccine trials. So we'll know a little bit more about that in the next month or two. And hopefully we can start getting children immunized as well for this, because that'll be really the only way, I think, to achieve kind of the herd immunity that you've probably heard about, get that 75% or so immunized throughout the US is by including, kids in that process.
Got it. Thank you so much.
Mm-hmm.
I have another question, or a question, sorry. How long do you think it'll take to vaccinate a majority of the population? Do you have an estimate?
So at this point, I think the estimate is probably late summer, early fall. That's assuming that everything goes based on the timeline that they were predicting at the end of last year. As of right now, I think a lot of people feel there's been a very slow start to the immunization process, but we've still had millions and millions of people immunized so far that have done very well. So I think for us to maintain our sanity, we just have to be hopeful that, by the end of the summer, we'll hopefully get as many as we can vaccinated.
Okay, thank you so much.
Mm-hmm.
There was a question from the chat. How safe is it to send our children to school face-to-face if we have elderly at home?
So that's a really tricky question, because there's always a little bit of a balance, especially if there's high-risk family members at home. But in general, depending on the age of the children at home, if they're at an age where they can very reliably, wash their hands and wear their masks, especially when they're around other kids, we found that there are definitely benefits to having the kids in school. And what we've typically been doing is, if there is, a high-risk family member at home and a child is in school, and say if they even develop a few symptoms of whether cold symptoms or a little bit of diarrhea or whatever else, we've actually had the ability to get them in pretty early on, get them tested if we need to, and we've tried to have them isolate a little bit from the higher risk family member at home, so that until we get those test results, we can be really sure that everybody's staying fairly safe. But of course, every household has to kind of make that decision based on the information that they have and kind of the risk involved, because we really want to make sure that our kids are sort of maintaining their mental health at the same time, but we definitely don't want to put anyone at risk at home unnecessarily.
Thank you, Dr. Mahapatra. I have a question for Dr. Chaudhari. So how exactly, or like how important is it to get the second dose? Because I know it's known to be very important, but are there like statistics, or is there anything kind of that says exactly why it's so important? Or because I know that there might be people who may just stop after the first dose, but so how exactly, is it as important?
Yeah, so if you like to see that both Moderna and Pfizer vaccines have a booster dose. The booster dose actually boosts your vaccine. So like most of the vaccines are designed to have a 1, 2, or single dose, depends on how the vaccine has been made. So the Pfizer, to my understanding, and correct me if I'm wrong, Dr. Mahapatra, so the Pfizer, to my understanding, when you take a first dose, your efficacy of the vaccine is about 50%. And after second dose, it's jumping to about 95%. And for the Moderna, what I heard from the literature is about 70 to 80% after first dose, and after second dose is about 94%. So even if you take a first dose and it does not take the booster dose, you still are protected, but not to that extreme. So I would strongly encourage to take and complete the dose of the vaccine to get that 95 to 94% of kind of safety after taking a vaccine. So it's very important. If you just take one dose, your success of fighting this disease is not very high.
Thank you so much.
That is my understanding as well. The efficacy is much better after the second booster dose.
I have a question. So if you get the COVID-19 vaccine, either Pfizer or Moderna, you get the first dose, are you able to get another vaccine dose that is not COVID vaccine? So like, for example, like in this case, like a flu shot, are you allowed to get both at the same time or any other vaccine?
They are typically recommending waiting 2 weeks, either before you receive the COVID vaccine or 2 weeks after you receive the COVID vaccine, just to give a little bit of a kind of lag period there in terms of any other vaccines.
And I think it's also true, the same thing. If you're having an active like a cough or running nose or fever, then definitely you want to wait until for at least a week or two before you get your vaccine.
There was a question from the chat. How long should an elderly person wait to get their vaccine if they already recovered from COVID in November? Is it safe because they may already have antibodies?
So in general, of course, every person is different in how their immune system will respond to something like a COVID infection. But right now, they think the natural immunity after COVID infection lasts roughly 3 months. So if correct me if I'm wrong, Dr. Chaudhary, but I believe that that's about the time frame that they're recommending to receive the COVID vaccine after an active infection. At least about 3 months or so. Now, again, every person would respond differently to any type of infection. So for some people, that natural immunity, it may only be 1 or 2 months. For others, it may be 4 to 5 months. But in general, I believe they're saying it's about 90 days protection after an active infection.
Yeah, that's what they're recommending. I think you should take a COVID vaccine after recover from the COVID within 90 days, so kind of period mark. You don't want to wait too long, because you may end up getting a period when you are not covered, and just make sure that you have vaccine in the meantime.
I have a question, and this may have already been addressed and I missed it, but I heard that there's a new UK variant that has come of the COVID virus. So is the vaccine that have already been created, is it effective against this variant, or will there need to be a whole new vaccine for that?
So as of right now, they've actually started some studies to kind of ensure that. It seems positive that it does cover that variant. I think from what I've read in the literature, the one that they're a little bit more worried about is the South African variant. If I remember correctly, Dr. Chaudhary can correct me about this if I'm wrong. But as of right now, they've started some studies to make sure that these variants will be covered. They have not said that potentially a new vaccine might be required, but there's always a possibility that maybe in the next year or so, there might need to be a booster dose of some sort. And I think these companies are looking into that as they're doing these research on these variants as well.
Yeah, so that's what the theory is. I think if you already get a COVID vaccine with a previous kind of virus and you're now getting a new virus heat, probably your prior infection may not cover this one. But the way how the vaccine has been designed and manufactured is kind of mRNA vaccine. So RNA vaccines work, I think, very differently than a typical old vaccine, which is a live or kill virus vaccine. So in the and this is all data from existing literature. We still don't know a lot of things. We'll learn a lot in the future. But seems like the current existing vaccine, both Pfizer and Moderna, are able to provide you protection against this new strain.
Yeah, and there was another question in the chat. Do any food or medicine allergies interfere with the COVID-19 vaccine? As of like right now, is there any research done on that?
Not
I
aware of
haven't
it.
seen anything about food or medication allergies, but I believe one of the contraindications to the vaccine is if someone has had a severe allergic reaction to a vaccine in the past. But as of now, I have not seen anything about a food allergy or, say, an antibiotic allergy, anything like that.
Great.
Hi, I have a quick question. I actually work in a medical practice at Medical City Plano, and I received the Pfizer vaccine, the first and second dose. And I had a question in your guys' experience, either of you guys can answer, but have you guys noticed that certain people were more symptomatic with the Pfizer or Moderna, or has there been any patterns with whether it's like gender-based or racially based that certain people react differently with different vaccines?
Yeah, I heard, and this is also, as we don't know the data, we just learn from the people and talking to the people and healthcare workers. I think Pfizer has a little bit more kind of reactions and more symptoms than Moderna after second dose, especially. And the people who have get COVID before, they pretty much like this is acting like a third heat, and they kind of I've seen with their experience, they get more symptoms for 1 or 2 days after vaccination. But we still don't know what's the reality and what science and why this happens. But that's what been experienced by talking to people.
And I think the other thing to keep in mind as well is that the people that are receiving the second Moderna dose, that kind of all just started in about the last week or two, whereas we have several people who have already received the first and second doses of Pfizer. So of course, we're going to hear about more people that are having reactions to Pfizer versus Moderna. Maybe in a few more weeks, we'll have a little bit more data from that as more and more people start receiving that second dose. And that's just because of the time frame when you have to receive the second dose, comparing each vaccine.
But
Right.
I think
Okay.
whatever,
Thank you.
even though regardless of whatever the symptoms you get, most people get very minor symptoms to just a fever and some discomforts and body ache and malaise, nothing more than that. So I think most symptoms most people respond very well to Tylenol or some other medications and does not require any more invasive care.
Got it. Thank you.
And we have another question in the chat. So what information can people use to determine whether the Pfizer or Moderna vaccine is the best to take, I guess, in their own personal situation or in general?
I think either of them is available. I don't see any difference between both.
Okay.
I had a question as well. Like, what do you guys think is going to be like the course of this vaccine? Is it going to be like the flu shot where you get one like annually, or is it just like a one-time shot?
I think right now that's very difficult to answer because a lot of it may be determined on what happens with these variants that are coming out. I think the expectation is that COVID-19 is going to be sticking around for a while. So depending on how things proceed over the next few months, I think a lot of the epidemiologists are expecting that this may be something that we would have to take annually. But we'll have more information as we see how the general public responds to the vaccines over the next few months and how COVID in turn returns response to the vaccination in general.
Great. We just don't know right now. To be honest, we don't have any data. We're hoping that it should not be annual, but we just don't know.
Thank you.
Hi, I had another question. So are there any symptoms that might come from the vaccine that are unexpected that require us to treat the situation differently?
I think that, as Dr. Chaudhary had mentioned earlier, severe reactions are very, very rare. And in general, they are actually watching people after the vaccine, typically for at least 10 to 20 minutes or so, just to make sure that there are no immediate severe reactions. So as of right now, based on the millions of people that have taken either of these vaccines, the majority are doing pretty well. Again, of course, as always, more and more data is needed. So more people that get the vaccine, we'll be able to give that answer just a little bit better over the next couple of months.
Great.
Okay, thank you.
Also, one more thing, I guess piggybacking off that question, once you do get the vaccine, do you treat the current pandemic any differently than we already are?
So I did address that just slightly, but unfortunately, until we receive herd immunity, which means approximately 65 to 80% of people would need to be immunized, it really won't change kind of our social distancing or our wearing the masks. Again, because people can carry the virus and be completely asymptomatic, and there's not a lot of data in terms of transmitting to other people. So there's that risk there of potentially passing the virus to others even after you've been vaccinated. So unfortunately, we're still kind of in a long haul in terms of wearing masks and wearing the protective gear until we get closer and closer to getting the majority of the public vaccinated.
Absolutely. I think until we don't get that 75% mark where we can say like we have a vaccine and some people get disease, and we can probably bank on that. And hopefully by fall, we should come in the situation that should we continue wearing mask or not. I would say if we get off the mask by the end of this year, we'll be very lucky.
I agree. I think we're looking at it throughout the year, unfortunately.
Absolutely. We're all looking forward to this. So.
There are 2 questions from the chat. The first one is somebody asked, I'm taking my parents for their second dose of the Moderna vaccine. Is there any precaution that we should take considering they're elderly people?
No, I think as long as they don't have any recent symptoms or running any fever or any kind of reactions or any symptoms, I think it's what I suggest you after taking second dose. It's not a bad idea to take Tylenol like same day, maybe 500 milligrams. You can take 1 or 2 pills that day or for a couple of days. They definitely help you to keep your fever a little bit lower. I just tell you, my mother received vaccine for this weekend and she got fever that night and day after, but she feels really good after that. So 1 or 2 days, you definitely expect some symptoms. So as a preventive measure, it's not a bad idea to take some medication.
And they did recommend for us as well, for people that are working to maybe potentially try and take the following day off after receiving the vaccine. So that might be another thing to kind of keep in mind as more and more people are receiving the vaccine. But otherwise, yes, Tylenol, that should be just fine to help with any of the body aches, chills, fever, things like that.
So just to clarify, taking a Tylenol even before you get any symptoms is a good idea?
I think it's not a bad idea to take that right. Like if you start feeling like a little bit your body ache, you will know like it's coming. Just take medication is not a bad idea for 1 or 2 days.
Got it. Okay. And then the other question.
Oh, sorry.
The other question. Oh, sorry. Go ahead.
I actually had a specific question regarding painkillers. So as I said earlier, I did get my Pfizer vaccine. And after my second dose, I got very symptomatic for about like 2-3 days. And the lady that administered the vaccine to me, she said that I'm not allowed to take ibuprofen or Tylenol within 12 hours of receiving that second dose. Is there a reason for that? Or is this like a universally accepted rule with like the painkillers?
I'm not aware of this one quite well. Dr. Mahapatra, do you have any insights in this?
So I have not heard specifically about that 12-hour time frame. There are some kind of studies out there, I guess if you want to call it that, where they're saying if you take, medications like Tylenol or Motrin, it might sort of lessen the immune effect. That being said, I think you have to look at the risks versus the benefits. Of course, if you're not able to make it through your day because of fever, chills, and body aches, or if you need to complete a school project, or if you need to work, I think that it's better to just take a medication if you need it, rather than suffering through those effects. And again, everyone is very variable in the kind of effects that they've had. So for me and for the majority of people I know, their effects didn't really set in until 18 to 24 hours plus. So if it was within that 12-hour period, I have not heard of anybody recommending not taking anything during that window. But if that is the reason that they said that, that's the only thing I can think of as far as why they would have said that.
So we have another question from the chat. They say if the majority of individuals get immunized by late summer, early fall, even though we might still have to wear masks for the rest of the year, do you think it is likely that to have some degree of normalcy compared to life we're having right now?
I think that's the goal to hopefully have a little bit, at least, where people can have maybe public gatherings by fall or winter time, and even if you have to wear a mask, maybe potentially at least being able to have these couple of extra things that we've been used to. But I think the next few months will be very telling.
Yeah, I believe so. I think it's if we by late summer or fall, if we more than 75% people, if we get immunized, and because the success of the vaccine so far in the trials is about 95%, so your odds of getting COVID without like any protection is probably about 5%. But I think if you have a mask on, that odds would go significantly down. And if everybody continue to wear mask and maintain some sort of social distancing after vaccination, I think by fall we should be pretty close to not fully controlled, but at least we can breathe better.
We have another question from the chat. As a healthy 18-year-old college student with no underlying conditions and who is not yet in the medical field, when can I expect to receive the vaccine?
So it likely will be, after April, maybe April to June is what they're anticipating. But of course, that's always subject to change based on how the next couple of months go. But I think they're anticipating getting the vaccine out to kind of our healthy general public, hopefully by early summer at the latest.
I agree. Absolutely. Yeah.
I actually have a question about masks. So I know that there's been a lot of talk about cloth masks not being as effective as we thought they were, and that people are trying to wear 2 masks at once. So what is your opinion on that? And is that more effective? Is it worth it?
I would say any mask is better than no mask, just as simple as it is. Is it a cloth mask is better than no mask? Absolutely. It's just a face shield by itself without mask is better than a cloth mask? No. I think a mask, any sort of mask is good. Of course, N95 has been proven with more than 95% efficacy. They have multiple layers. They filters through air and protecting your disease. Your regular surgical mask, which is other mask, which is commonly worn, is also quite effective, not as good as N95. Some just regular scarf and not really have any with the big macro pores. They are not as effective. Absolutely, it's not. But I think it's better to have something than nothing. But I think using some sort of mask, it's actually better than no mask.
Okay, so before we move on and continue, I would like to take a screenshot of everybody's here. So please, if you can turn on your camera, we can take a screenshot of how many people are here. That'll be very great.
How it is? You have to tell me.
All right. Thank you, guys. I'll give you guys a couple more seconds to turn your cameras on. All right. Say cheese. Okay, the picture is taken, so we can continue on more questions if everybody has any.
I have
one question. My question is, other than Pfizer and Moderna vaccines that have been approved, are there any other vaccines in line that are close to being approved and made available? Like I was reading about Johnson and Johnson vaccine.
Yes, I believe that is the next one that's likely going to come up for approval here. What I know about that one is that it is a single dose vaccine. The efficacy does seem quite a bit less than the Pfizer or Moderna, but the fact that it's a single dose would make it much easier to get a larger proportion of the population vaccinated with it. My understanding is that vaccine will likely be coming out for approval in the next few weeks, maybe even a bit sooner.
Thank you. Thank you so much.
So if nobody has any more questions, we'd like to conclude this presentation. So we'd like to give a big round of applause to Dr. Smita Mahapatra and Dr. Nilesh Chaudhari for their questions, their answers, wonderful answers to all the questions that we had. So thank you guys for your time. And as healthcare professionals, we'd like to thank you for that, what your contribution have done to this COVID pandemic. It's very wonderful. So thank you guys.
Thank you guys for putting this together. It's very nice of you guys.
Beautiful, guys. Keep doing this kind of stuff and spread the words.
Yes, exactly.
So you guys can follow us on our social media platforms as well as our website. So right now, if you would like to, for us to go to any of the QR codes, you can scan them for more information, and please let us know in the chat. But other than that, thank you guys for coming.
Thank you. See you all.
Thank you.